So, good morning, and today we are going to see about the cranial nerves number 2 and 3. So, talking about the cranial nerve number 2, it is the optic nerve, which is, as the name suggests, a purely uh, sensory nerve, and therefore it is connected to the functional component special somatic afferent. And of course, it is carrying the very crucial impulse of the visual signals, that is the optic signals. Okay, so starting from the eyeball, or to be more precise, from the retina, we have the beginning of optic nerve. So I'm not going into the details of the functional components as we have already seen it in the previous class. So from here on, I will only be mentioning about the functional component, what each cranial nerve is associated with. So for the special sense of vision, we have the optic nerve. Earlier, there was always a debate on whether it should be considered as a nerve or a tract. So there is, as many authors will still mention optic nerve as a tract rather than a nerve, because the optic nerve, when we see its development, it's directly coming from the forebrain. And as mentioned in the previous class, this is the second of those cranial nerves which is not attached to the brainstem. So the first one, that was olfactory, and this optic nerve, both are attached to the forebrain part. So it is connected to the retina, which is of course the neural layer of the eyeball on which the receptors of vision are embedded. So from there, it takes the signals of the vision, and from there on, it is continued as called as a optic nerve or optic tract. When we see the differentiation in this diagram, we can see the optic nerve begins from the retina, and then we can see it has many of those fibers have a crossing, and which is called as the optic chiasma. And after the optic chiasm, the part of this nerve is rather called as optic tract till it reaches to the lateral geniculate body in the thalamus, or associated close to the thalamus. And from there, it is further projected as optic radiations, which will reach, of course, the occipital lobe where you have the visual cortex. So receptors are coming from the bipolar neurons, which are embedded in the layer of retina, and that is the first order neuron, of course. And from the ganglion cells, that is exactly where the optic nerve bipolar, the optic nerve fibers begin. So from there, it creates the optic nerve tract, and that is what comes out of the eyeball through the optic disc as an optic nerve. There is a specialty of optic nerve that it also carries a blood vessels inside, that is the central artery of retina and the vein. So this optic nerve, that is why it is still debated on whether it has to be a nerve, or for our purpose we are still seeing it as a cranial nerve. And the nerve as such, in that definition, if we say till it reaches the optic chiasma, is only 4 centimeters long. Thereafter, the chiasma we had mentioned, it is having called as optic tract. The optic nerve, is an extension from the brain. We can see it is covered by all the 3 layers of the meninges. So from the optic disc, this optic nerve fibers, which are the ganglion cell extensions or axons, they will begin to travel as the optic nerve till it has the optic chiasma. And thereafter, we will see from the optic chiasma or at the optic chiasma, the medial fibers, which we call as the nasal fibers, will decussate or cross to the opposite side. And the lateral fibers, which is called as the temporal fibers, do not decussate, do not cross, they continue in the same side. So at the optic chiasma, there is only the crossing of the nasal fibers of the optic nerve. So that which takes the sensory impulse from the medial aspect of the retina of each side. So those will cross to the opposite side, and that is why we call here it as the optic chiasma. Now, after the optic chiasma, the uncrossed temporal fibers and the crossed nasal fibers will rather be called as the optic tract till it reaches to the lateral geniculate body, which we can say is one of the most important relay station of the optic pathway. So this lateral geniculate body is situated just behind the thalamus. Some authors include it as part of thalamus, but actually it is outside or just behind the thalamus. And from the lateral geniculate body, the last order of neurons, which we call as optic radiations, that is what will then carry the signals to the visual cortex that is lying in the occipital lobe, area number 17, which is the primary primary visual area. And then, of course, there is the associated visual areas 18 and 19, which will store the older impulses or connections of the older visual impulses. So this is how the optic nerve in its pathway is formed. So arising from the retina, the optic nerve will travel outside the optic canal and come to cross just behind the anterior cranial fossa, the midline, and that is what we call as optic chiasm. And in the chiasm, as we mentioned, the nasal fibers will cross and the temporal do not cross. And after that, it is optic tract, which is reaching to the thalamus, or to be more specific, the lateral geniculate body, where they are having the last order of neurons which will radiate, therefore called optic radiation or projection, to the visual cortex that is in the occipital lobe. So this is solely or only carrying the signals of vision. Whereas the eyeball does have other functions also, where we, as in the sense where it controls the amount of light that enters into the retina and such kind of reflexes, that is the accommodation reflex, the light reflex, these are not carried by the optic nerve. Now these are those reflexes we will see in the coming cranial nerve, that is the next cranial nerve number 3, oculomotor. So here, please understand, the optic nerve is purely sensory and it carries only the sensory impulses of vision. And there is, of course, a certain limb or certain part of the reflex pathways coming through the optic nerve, but that will only be the sensory limb of the reflex. Now, applied aspect, there's a lot of conditions associated with vision, and a lot of them are connected to the optic nerve. Some of these are which are shown here: hemianopia, bitemporal hemianopia, harmonious hemianopia. So these are all depending on which part of the optic nerve is having the lesion. So of course, the field of ophthalmology is very vast. So summarizing the optic nerve, the special somatic afferent is the functional component. The relay station is at the lateral geniculate body, where the last order of neurons will radiate to the occipital lobe. And then as a nerve, the nerve exits from the orbit through the optic canal, and the receptors are lying in the retina. and of course the main sensation or function is carrying sensation of, say, impulses of vision. So this is about optic nerve. Now coming to the next cranial nerve, that is 3, oculomotor. As the name suggests, it is a purely motor nerve, uh, and it will have functional components of two types, of two functional components. One is the general somatic efferent, another is the special visceral. Now there are muscles which are uh, controlling the intrinsic movements of the eyeball and also the extrinsic movements, or we can say the extrinsic muscles, the extraocular muscles. So many of these extraocular muscles are supplied by the oculomotor nerve, and whereas there are some intrinsic muscles which we call as sphincter pupillae, ciliaris. Now these are parasympathetic and autonomous control, and therefore that is also being supplied from the through the oculomotor nerve. But it's, of course, the functional component is different, special visceral efferent, and therefore the fibers will be traveling separately or from the extraocular, but through the same cranial nerve. Okay, so the fibers of oculomotor will reach or will start from the midbrain. So cranial nerve number 3 and 4 both are coming from the midbrain. So the oculomotor, we can see when we study the midbrain sections, we will see the oculomotor nucleus, and from there will arise the general visceral efferent fibers. So that is going to the uh, extraocular muscles as upper and lower divisions of oculomotor. So upper division of oculomotor will supply to the levator palpebrae superioris muscle and the superior rectus, whereas the lower division of oculomotor will supply to the medial rectus muscle, the inferior rectus muscle, and inferior obliquus muscle. So altogether, we can say 5 muscles are supplied, out of which 2 are supplied by the upper division and 3 muscles are supplied by the lower division. So the functions of these muscles, of course, levator palpebrae is to raise the upper eyelid, whereas the other muscles are directly attached to the eyeball, that is superior rectus, elevation of the eyeball, and medial rectus, the adduction of the eyeball. The inferior rectus primary action is lowering the eyeball, inferior oblique. So these kind of actions are what the oculomotor fibers carry. So raising the eyelid, directing the eyeball according to which muscle it is stimulating, constricting the iris, and controlling the shape of the lens. Now, constricting the iris and controlling the shape of the lens are purely uh, parasympathetic, parasympathetic function. So that is what we mentioned as sphincter pupillae muscle and ciliaris muscle. Sphincter pupillae will constrict the iris, whereas ciliaris will help to adjust the lens shape or accommodation reflex. So this is what we called as the light reflex and accommodation reflex. So that is being carried by the oculomotor nerve also. So that this is the first cranial nerve which we have so far seen carrying parasympathetic fibers. So cranial nerve number 3. The parasympathetic cell bodies, or we can say the ganglion for the relay, is called as ciliary ganglia. And this is normally attached to the lower division of the oculomotor nerve. And from the ciliary ganglia, the postganglionic fibers is what reaches to the sphincter pupillae muscle and the ciliaris muscle. So that is about the parasympathetic relay that is connected to the oculomotor nerve, ciliary ganglia. So oculomotor nerve, as we can see here, summarizing, comes out from the midbrain, from the ventral section part of the midbrain, and that is between the 2 cerebral peduncles, to be precise, and passing through the interpeduncular fossa, it enters the cavernous sinus in its course. So it enters the cavernous sinus wall, and traveling through the cavernous sinus, and then it comes towards the superior orbital fissure. So that is the cranial foramen through which it is entering the orbit. And as it is entering, it will divide into the upper and lower division. And the upper division, as we mentioned earlier, goes to supply the levator palpebrae superioris muscle and the superior rectus. Whereas the lower division, which normally has the ciliary ganglia, will supply the other three extraocular muscles, and through the ciliary ganglion, postganglionic fibers, it will carry the parasympathetic fibers to the sphincter pupillae and the ciliaris muscle that is connected to the light reflex and accommodation reflex. So this is the relations and the pathway or the course of the uh, oculomotor. So passing on the lateral wall of the cavernous sinus, as you can see here, normally it sometimes it will divide within the cavernous sinus itself as upper and lower division, or as it is coming out of the cavernous sinus. And then it is the divisions will enter the superior orbital fissure, and normally the lower division will have the um, ciliary ganglia. So as you can see here in this diagram, the lower division has the ciliary ganglion through which the preganglionic fibers will come, and the synapse, and then uh, the postganglionic fibers. So preganglionic fibers come to the ciliary ganglion, and postganglionic goes out to supply the ciliaris muscle and the sphincter pupilla. So this is the importance of the oculomotor, that not only does it stimulate the extraocular five muscles, but it also is very important to check the light reflex and accommodation reflex, because this is what uh, carries it. The impulses are being carried by the oculomotor nerve. So oculomotor nerve applied aspect, when you have oculomotor nerve palsy, you have ptosis, which is drooping of eyelids. The pupillary reflex may be absent, and therefore, when you do the light reflex, you have dilated pupil, lateral squint because of the medial rectus paralysis, loss of accommodation reflex, again because we are losing the fibers from the ciliaris muscle. So for the ciliaris muscle. So these are some of the signs which we can associate with the oculomotor nerve palsy, uh, along with other applied signs also. So light reflex, just want to take a mention on it, is starting from the Edinger-Westphal, and the optic nerve will carry the sensory limb of it, because of course the light is entering through the uh, eyeball, and that will carry the sensory pathway, and once the sensory fibers will come to the midbrain, that is, it is then connected to the Edinger-Westphal nucleus and pretectal nucleus, from which you will have it going out. That is, a motor limb is carried out through the oculomotor nerve to the ciliary ganglion, and from there to the respective muscles. So that is about light reflex, which will cause the pupil to constrict when light is entering, and the accommodation reflex is connected to the ciliaris muscle. Again, the same light uh, signals will come through the optic nerve, but the motor is carried through the oculomotor. Sorry. So this is about the importance of the cranial nerve number 3, and so I hope you could understand the importance of cranial nerve number 2, that is optic, which carries the vision, and cranial nerve number 3, which carries the signals to the muscles which move some eyeball, and of course the intrinsic muscles of the eyeball also. So thank you.